The first thing we need to do is really figure out how do we measure patient engagement, and that is going to be measures that I think need to be subjective, because people are going to have a different definition of what it means for them to be engaged. But right now we haven't even had the ability to really measure that well, and so we don't know where we stand today. And a lot of healthcare systems will say, I'm doing patient engagement, and then you ask them, what are you doing? And you say, oh, well, I have a portal where a patient can look up their lab results. And again, maybe for some patients that feels, like they are engaged, but for other patients that probably is going to really fall short of how they want to be engaged. But again, until we measure it, it's going to be very hard to know how we're doing, and going to be very hard to ultimately tie incentives to it, which I think is going to be the really transformative piece of this, is when healthcare delivery systems feel like they have to prioritize patient engagement if they want to be competitive and effective. And I think patient engagement has just not reached that level of prioritization to date.